And pranams to His Holiness. A very warm welcome to all our respective viewers joining today on YouTube Live. Over the past 5 days of World Breastfeeding Week 2026, we have been bringing you important session on maternal and child health. The session which we discussed is on importance of the breastfeeding, clearing common myths, the nutrition for mother, covering the government schemes of new moms. All the sessions were aimed at supporting mother, the family, and the health professionals with correct information and guidance. And today we are in yet another important session as part of this week is the common breastfeeding challenges. The difficulties many mothers face like hatching problem, low milk supply, pain and stress. And most importantly, how to overcome with the right support and knowledge. I hope today's session will fulfill that. I am very happy to introduce our speaker for today, Dr. Madhumita, BNYS, MD in Energy Medicine, heading the Department of Biochemistry, and she has an expert in the field of maternal and child health at our institution. Dr. Madhumita has extensive experience in patient caring, teaching, and health education. Today, she will guide us through practical solution for the challenges mother facing during the breastfeed. Please join us and give her a warm welcome. Dr. Madhumita, over to you.
Thank you so much, ma'am. I am Dr. Madhumita. So today we'll be seeing about the challenges of. Okay, so breastfeeding. First, when we all think about breastfeeding, what is the emotion which is connected to us? So a mother picking up the baby is like first time holding a stranger in her hands. So holding a stranger in her hands and feeding with the breasts, the emotion is completely complex. She doesn't even know how to react to that breastfeeding reaction, and even the baby uh, does not know anything about it. So it is just an internal instinct for us to react to the breastfeeding for the mom and for the baby. It is like no one has taught them how to breastfeed. No one has taught the child, or no one has told the mom that you have to teach the baby to suck. But this is just an emotion which happens immediately after childbirth. Okay, so what we think is many of the mothers think like breastfeeding is a very normal process. As soon as the baby is born, the expectation for mom is very high. Like as soon as the baby is born, she'll keep the baby near her breast. It starts latching. So that expectation itself is a very challenging for the mother. That and there's another called as hormonal shift. Immediately post delivery, her cortisol levels are increasingly high. Even our oxytocin is high, but similar to that, her cortisol is very high because of increased cases of cesarean delivery, episiotomy, and normal delivery. Her cortisol in the body is very high due to the pain and all the hormonal shifts. Because of all these problems, the breastfeeding is being very challenging to the woman. Okay, next the mother-infant bonding. So what happens in majority of the hospitals by today is that they separate the mother and the baby immediately after childbirth. So that actually increases the cortisol level in the mother. The mother thinks that is my baby all right? Is my baby okay? Are they taking care of it? Is he breathing? Is he crying? For what he is crying? So all these thoughts will just incorporate in the mother's mind. So mother-infant bonding is very important immediately post childbirth because that creates a very an immense oxytocin release immediately after childbirth. So mother-infant bonding can be like the infant can be put on the mother's chest, something like that, so that the baby will start searching for the best breast and sucking onto the breast. So this happens. So for that to happen, you need this mother-infant bonding. If the mother-infant bonding is not there, there is high amount of cortisol released in the mother's body as well as in the baby's body. Baby loses its attachment with its only source, which he had known for the last 10 months. So because of all these, breastfeeding can be very challenging. Okay. And bonding is a very gradual journey. It cannot happen at once a time. So mother has to bond with the baby. It will take around 1 or 2 months for the baby to adapt to the world, for the mother to adapt to the baby, for the mother to adapt to the new situations. So all these can be very challenging to the baby. Okay. Next we'll come out about tiredness and confusion. Okay. So as we all know, for the first 3 months, the baby requires feeding for at least 2 hours once. So what will happen is in this 2 hours once, the mother's body is extremely exhausting and tired. She cannot even compensate her own tiredness and the pain following her childbirth. So all these will result in too much of exhaustion. When too much an exhaustion and pain is there, you will have cortisol increased over there. Cortisol is a inhibitor of the milk production. That is, cortisol இருந்தா வந்துட்டு ஆக்சிடோசின் ப்ரொடியூஸ் ஆகாது. ஆக்சிடோசின் ப்ரொடியூஸ் ஆகலைன்னா மில்க் செக்ரீஷன் வந்துட்டு கம்மியா இருக்கும். ஸோ மில்க் செக்ரீஷன் கம்மியா இருக்கிறத விட that milk will not reach the baby. The let down reflex of the breast will be down. So that is mainly because of sleep deprivation and information overload. So information overload is like nowadays we have many social media sources telling us different things. Not only the social media sources, we have our grandparents, our mothers, we have too many generations in our family explaining their experiences, which may confuse the mother even more. So what will happen is, okay, I'll just come to the next slide. Okay, understanding crying. So the main problem in breastfeeding is the baby crying. So baby is continuously crying. All family members, friends, everyone will keep telling your milk is not sufficient, so the baby is crying. So baby cries are not only dependent on the milk. It is dependent on many other reasons also the baby may cry. Okay, so crying is just his vocal communication. The baby does not know to speak. If it is us, we can tell this, like this is happening to us, but the baby cannot tell it. So baby communicates with us through crying. So crying does not actually mean they are only hungry. So interpreting these signals wrongly can actually influence both the mother and the baby in a very wrong way. Okay, so this will increase the maternal stress in a very larger level. Okay, so why is the newborn crying actually? So newborn crying, the first hunger cue is that they'll open their mouth, they'll start rooting. That is, they'll take anything which is nearby them to their mouth. They'll put their fist into their mouth. They'll turn towards the breast. So all these are hunger cues. Because of that, the baby is crying. So this is the first hunger cue. The second hunger cue only will be crying. Crying is not the first hunger cue. It is always their mouth open, rooting, putting fist to mouth, turning towards breast. This is the first hunger cue which is shown by the baby. Only when this is not satisfied, the baby goes to the next stage, that is, they start crying. So when they're crying for a very longer time, they'll actually become tired. So when they are tired and when you try to breastfeed them, the baby will actually not drink sufficient milk. Okay, so this is one reason baby is crying. The other reason is fatigue. So newborns need a lot of sleep. So when someone is sleeping, when the too much lights are on, the baby cannot sleep properly. So over tiredness can also lead to crying. Dirty diaper. If the baby has gone pooping or it is peeing, it can also lead to a crying of the baby. Next is temperature regulation. If the baby is feeling overheated or if it is feeling cold, also the baby starts crying. Physical discomfort. If they have any gas in their body, if they are teething, if they have some ear infections or cold or fever, for all these reasons, the baby might cry. So blaming the mother at that point because of the baby is crying is actually a very big mistake. It is understanding the root cause why the baby is crying will help the mother solve the problem even more easier. It will become easier for the mother to identify the problem and to solve it. So whoever's nearby, we should support them to understand the newborn baby's cues. A mother should definitely know to need this all these baby cues. Okay, so this is a tired mother who's having insufficient supply of milk. She's not able to feed her baby properly. So low supply of milk. So low supply of milk is actually a myth. There is no low supply of milk until and unless the woman is severely malnourished or she has some endocrinal or metabolic disorders. The low supply of milk is actually a myth. There is nothing called as low supply of milk. Milk starts producing from the golden hour of birth. That is, from the first hour of birth, the milk is being produced. So the first milk produced is called as colostrum. So what will happen is, this all we've already seen in the previous topics. So what will happen is, when everyone around her tells that your baby is crying due to insufficient milk, the mother also goes into a state where, okay, my milk is not enough. So what will happen over a period of time, when she keeps thinking on the same thing, her body cortisol level increases. When cortisol level increases, as I told you, the letting down reflex reduces abruptly. So milk secretion is there, but the milk is not reaching the baby. So this is one of the most challenging breastfeeding complication for the mother. Okay, next is episiotomy. Episiotomy, cesarean section. All these are challenging for the breastfeeding, because when a woman has undergone episiotomy or cesarean section, it is very difficult for her to sit down and breastfeed the baby. So, but we have many positions to breastfeed the baby, but many generations they have been following by sitting and breastfeeding. So this is a very major misconception. So when she's sitting and breastfeeding, she cannot sit for a longer time. She cannot breastfeed her baby like calmly. So that will lead, that is also a very big challenge in breastfeeding. So supporting episiotomy, we can give them sitz bath. For supporting cesarean section, we can give them football hold of breast position. So all these should be inculcated to us to for her to overcome this challenge of breastfeeding. Okay, so as I told you, there are multiple breastfeeding positions. All these can help her manage the post childbirth pain. So what are the positions? You have this cross cradle, football hold, side laying, and also the supine lying positions. So all these are multiple breastfeeding positions we have. So if someone has undergone a cesarean section, it is really recommended for them to go for a football hold position than for a cradle position. Why football hold position is greater than the cradle position is that football hold position will the scar will be like the baby will not touch the scar, so that the mother will not feel any discomfort while feeding. So that for cesarean section, a football hold is very much necessary. Whereas if a woman has undergone episiotomy, or if they have undergone episiotomy, they can give breastfeeding in side lying or in a supine lying position. So these both will help actually ease their episiotomy pain and help them heal faster. During episiotomy or a cesarean section, straining her on a more excessive level will actually delay in the healing process. So we have to know about all these breastfeeding positions and then tell it to the patient or the woman, so that she has a very smooth breastfeeding journey. And she'll also have some postural strain during breastfeeding. So postural strain can be given by a wedge-shaped pillow, or back support, neck support can be given to improve her posture. And healing support, if they have episiotomy and if they have to feed during sitting, we can give them donut cushions or supportive pillows or water bags, which can relieve the localized pain in that area. Okay, so types of nipples. So a baby should properly, only then a breastfeeding journey will become normal. So for the breastfeeding journey to be challenging, the nipple type also is like plays a very major role. So what are the types of nipple is that you have grade 1, grade 2 and grade 3. So what will happen is grade 1 is that a protruding nipple, that is a normal nipple. Grade 1 is that they'll have a flat nipple. Grade 2 is like between flat and an inverted. Grade 3 is inverted. So the sucking actually takes place in the areola and not in the nipple. So this is a very common misconception among the women. The feeding does not happen in the nipple, it happens in the areola. The baby latches onto the areola and nipple supplies the milk. So even in an inverted nipple or a flat nipple, breastfeeding is like completely, it is normal. So what happens in a flat nipple is that we can give them a C-shaped hold or O-shaped hold to push out the nipple, or you can use some vacuum pumps to push out the nipple. Inverted nipple can also be corrected very easily by using some home procedures. Like you can use some injection syringes, you can use a C-shaped hold or a O-shaped hold. You can use some vacuum pumps to pull out the nipple. Once the nipple is being pulled out, when the baby latches onto the areola, nipple supplies milk continuously. So that is not a problem. So this is one of the major challenge which the women are facing. So this is the prevalence of now. Nowadays, the normal nipple is around 95%. Around 75% of the women have flat nipple, and around 55% of the women have inverted nipple. So this is actually not a restriction for breastfeeding, but at nowadays it is seen as a common restriction for breastfeeding. Actually, no, it can be easily corrected as the baby latches. Around 2 months, the baby's latch will be even more stronger. So automatically the nipples forward. So this is not actually a very big restriction during breastfeeding. Okay, so breastfeeding latch. So you have a bad latch and a good latch. So what is a bad latch in the sense? The baby's mouth is not fully open; it is only half open. You can see a major part of the areola. It means the baby's latch is not good. In a good latch, the areola will be fully covered by the baby's mouth. His chin will be tucked to the breast. His nose will be he'll be able to freely breathe through the nostrils. So all these are signs of a good latch. So always remember, the latch is done to the areola and not to the nipple. So in a good latch, the mouth will be wide open, and in a bad latch, the mouth will be open a little. So why does this bad latch and good latch happens is that a bad latch occurs when the child or when the baby is suffering from any difficult anomalies or something like tongue tie or lip tie. When the baby is undergoing some tongue tie or lip tie, they'll be a bad latch. Otherwise, the bad latch in a child is very uncommon, or it may be because the baby is asleep, the baby is not interested in sucking, it will be a bad latch. If the baby has a good latch, then there'll be no problem. So to identify whether it is a good latch and a bad latch is also a challenge in breastfeeding. Okay, next is this cracked nipple, sore nipple, and the bleeding nipples. So all these are common problems which occur in breastfeeding. By proper education, counseling, and teaching the women, we can avoid all these problems. So cracked nipple and sore or bleeding nipple mainly occurs, one thing is because of dehydration of the mother. So what happens in regular households, the woman is not allowed to drink too much of water. This happens is a very common mistake. The woman has to drink much amount of water because the breast milk is like around 80 to 85% it contains water. So the mother should be hydrated as sufficient as possible. So being dehydrated will cause the skin will become very weak and will start getting cracking. So this is one reason. The second reason is the weather. In extreme winter weather or extreme winters or snowy weathers, this cracking of nipples can happen. But in our locality, this is very uncommon. It is common only in places like Antarctica or any hill stations. But in our places, it is uncommon because of winter weather. Even if they have a winter weather, we can just give them a humidifier, or we can give them hot steams somewhere, so that their nourishment to the nipples will be encouraged. The third reason is because of a bad latch. As I already told you about bad latch and good latch. So in bad latch also, this cracked nipples or sore nipples or bleeding nipples can happen. So what will all these cause is that it will cause immense excruciating pain to the mother. When the mother's pain is very intolerable, she is not able to feed the child. So this is one of the most common breastfeeding challenge for the mother. So we should be very careful in addressing the problem and how we have to overcome it. Okay, next is the painful breast. So painful breast is because there is proper supply of milk, but but the child has been given another sources like formula feeding or something else, or the baby has a very bad latch, or the mother has some of the nipple problems, or the mother has cracked nipple or something. What will happen is there'll be engorgement, because whatever happens, prolactin will keep secreting. And actually, when the cortisol is high, prolactin levels are very high. So milk secretion is actually double the amount. It is increased. So because of that, what will happen is milk will start getting engorged in the lacteobreast ducts, or it will get engorged in the breast. So when that keeps engorging, that will cause something called as breast engorgement. Okay, so this is called breast engorgement. So usually when milk is there, the breasts will be soft. So hard breast does not mean they are like they don't have milk. Soft breast also means they have milk in them. So another reason for this breast engorgement is too much of galactogogues. So what will happen is, since a mother is breastfeeding, there'll be like around 10 glasses of milk to the mother. There'll be too much of garlic given to the mother, but that is actually not needed in a person who's nutritiously if she's healthy, that is all not required. When too much of galactogogues in natural way or in artificial form, nowadays we have powders, mixes, all those when you are given, what will happen is prolactin levels increases on a higher level. So when prolactin increases very much higher, milk starts getting secreted more and more. All those will get engorged in the breasts. So this will cause a engorged breast. Okay, so when this engorged breast is not being treated, what will happen is there will be infection, because milk is a very it is a very nutritive substance. So any microorganisms will enter into it and start drinking the milk. So what will happen is when bacteria invades this milk ducts, it will cause something infection. That infection is called as mastitis. When it reaches a mastitis condition, it is very required for the mother to remove the abscess during breastfeeding. So all these can be very challenging to the mother. So as a naturopath, okay, so as a naturopath, we can correct all these by knowing a proper position to feed the mother, nipple abnormalities, and baby's tongue tie or lip tie is there. All this can be recovered on a very easier basis when we educate the women properly. So it is very important for all the women not to listen anything from unknown sources like social medias or their parents. Every experience in breastfeeding is very different. Not yours is the same as the next person. So always remember that and keep the same. Okay, other than that, we also have specific nursing challenges like feeding in public. Nowadays, breastfeeding is still not seen as a common thing, that is they are feeding their child. It is still seen as a different perspective. It is seen as in a different perspective. So feeding in public should be supported by everyone around in the public, be it a father, brother, anyone, whoever is in the public should support the mother to feed the child, because the child is hungry. Okay. Next one is going back to work. So going back to work is a very great breastfeeding challenge for the mother, because the mother cannot be with the child, so she cannot breastfeed the child as she thinks. So nowadays we have pumps for that. We can extract the milk and then pass it to the baby, but still pumping out milk has a high risk of contamination because it is given outside, whereas giving the milk directly to the baby has a high microbiome effect, and the breast can identify at what situation the baby is and can analyze the milk accordingly and give it to the baby. Okay, so this is very, very important in breastfeeding. Supportive family and unsupportive family. When you don't have a supporting family around you, the breastfeeding is very challenging to the mother, because each one will have each one. Like whether do you have enough supply to the milk? Why is the baby always crying? You can give them formula. Why are you lying down and feeding the baby? The baby might choke. So all these are common comments which we hear from the family side. Like, what are you eating? Why are you having so much of water? Have something which is very lighter. Don't eat this. Don't eat that. So all these are very pressurized to the mother. So always think on a mother's perspective. She's very tired. She's gone on childbirth. So it is very difficult for her to be breastfeeding. Whereas a supportive family will make her breastfeeding even more easier. So always support her, whatever it is. Even if the child is crying, carry the child along with you. If she's not able to breastfeed, give her a break. She can extract milk and she can give it to you. Don't give her multiple suggestions, because she's a mother. She has a natural instinct to what to give it to the baby. She knows whether her body has milk or not. Okay, so do not judge her at any cost. Okay, so how can we overcome all these challenges? For now, we have lactational counselors. As BNW's doctors, we can also provide assistance to the breastfeeding mothers. Partner and family support, this is very important. They can give other non-feeding duties like diaper changing, burping, making the child sleep. All these can be done by the partners and family, so that she can make her breastfeeding routine very easy. Maternal self-care, giving her appropriate hydration, balanced nutrition, and rest whenever she requires, so that infant sleeps, whenever the infant sleeps, so that she can physically heal her body and she can mentally heal her body. Mental reassurance. So there might be so many problems. It is always required for us to call a expertise, because when we don't know, it is you have to accept that we don't know and call an expertise. Instead, giving multiple suggestions is that it is very wrong. Okay, so thank you. So feeding a tiny human is a work worth recognizing. It is much more than the maternity leave or anything. That is a full-time work. That is like a 24/7 work, which is a work which is worth recognizing. I hope this would have been informative to you all. Thank you all.
So thank you so much, Dr. Madhumita, for this wonderful and very informative session today. You explained so clearly about how hormone helps in milk secretion and how important it is for a mother to overcome stress during this phase. You also addressed the confusion many mother facing due to the suggestion from the family members and gave practical guidance on handling babies crying, proper latching, and the pain management. You beautifully highlighted that everyone must support the mother, family members, health professional, and the community. You also spoke about the challenges faced by the working women, the pros and cons, and how crucial family support is to make breastfeeding successful. Your talk was very clear, empathetic, and useful for all mothers, families, and even the health professionals. Thank you, Doctor, for taking this time and sharing your valuable knowledge with us. Dear viewers, thank you all for joining today's session, a part of World Breastfeeding Week 2026. We will be back tomorrow with another useful online session. Please do join us again. Thank you once again. Okay.